Thank you, and I call Chris Little.
Thank you, Mr. Speaker. I welcome this opportunity that the Assembly recall presents for the Assembly to engage with a Northern Ireland Minister for Education on a significant challenge facing our schools here in Northern Ireland. I regret that an Assembly recall was necessary to make this engagement possible, and I believe this is the fourth time a DUP Education Minister has been recalled during the COVID-19 pandemic. Now, the DUP can present that as a targeting of an Education Minister, or they can take some reflection with regards to the nature of engagement that has taken place between this Assembly and the education portfolio. I think at this time we need calm and measured leadership, so I'll do my best to be as measured as I can today, Mr. Speaker. As I say, I think the DUP can pass this off as party politics or misrepresent it as a responsibility for the executive alone, but I would respectfully ask that they recognise the seriousness of this matter and change course. The Education Minister must recognise that the failure to at least communicate and implement the new pupil test, trace and isolation policy properly has caused significant concern and distress for teachers, parents and pupils across Northern Ireland. It is quite clear that a number of school leaders, some in my own constituency, which the member from East Belfast appeared not to recognise earlier, do lack confidence in the new pupil isolation guidance and consider that the testing and tracing capacity necessary for it to function was not adequately planned or implemented. School leaders have been overwhelmed by tracing responsibilities. The testing capacity for pupils was not in place for many. I think what is of most concern, however, Mr. Speaker, is the lack of communication from the Education Minister and, to be fair, from some other ministers over the summer months in relation to this and other matters that do affect the capacity for children to attend school, and that needs to be addressed. There is an opportunity for the Education Minister today, and at the Joint Education and Health Committee I am proposing to urgently and openly communicate the scientific and medical rationale for the new pupil isolation guidance, what, if any, alternatives are being considered to that guidance. For example, a differentiation between household and non-household contacts is being raised by many people, and also how the testing and tracing capacity it would require to function will be delivered and put in place. Mr. Speaker, I believe that the key aims for education are clear. It's the safety of our school population, maximising in-school learning, and ensuring that contingency arrangements are in place if attendance is not possible for any reason. We know. I'll give way briefly. Yeah.
In relation to testing and tracing, in regards, what specific measures were put in place for special needs schools? There's unique circumstances there, and if the PHA does take over track and tracing, what measures will the PHA put in place to ensure, in regards to special needs schools, that those unique circumstances are taken into consideration?
Very grateful for that intervention. It's my understanding that some special arrangements have been put in place for special schools, particularly in different forms of testing. However, it's my understanding that there are special educational needs pupils in mainstream schools that need access to those different arrangements as well, and are experiencing some trauma by not having different arrangements in place at this time. The Children's Law Centre has issued a statement warning that children with special education needs are being forgotten again in this stage of the pandemic, as they were unacceptably in other stages. So it would be good to hear from the Education Minister on those particular issues today. Another key action that can be taken is indeed the delivery of enhanced ventilation and air quality in schools via the provision of CO2 monitoring and air filtration devices. My colleague and Alliance Party leader Naomi Long first requested such provision in the summer of 2020, and yet Northern Ireland remains behind other jurisdictions on this matter, such as Wales, where a £6 million air quality fund has been allocated. There is also a need, of course, for comparative data on pupil infection and attendance rates to assess the safety and functionality of any approach to the new school term. But the initial experience of teachers, pupils and parents and guardians does suggest that there is need of much clearer communication and perhaps even review. Mr. Speaker, the Education Committee heard that community transmission is also impacting on the ability of our children to attend school. So we respectfully request also for the Health Minister to communicate clearly on what is being done to bring that community transmission that is impacting the attendance of children in school under control. The children of Northern Ireland have sacrificed a great deal during this pandemic, and it is time to set out clearly from the Education Minister, the Health Minister, the Chief Medical Officer, an understandable and deliverable plan that will keep our children safe and in school. Thank you.
I get a call.